Hi, I'm Dr. Bill Lanting, America's Allergist. In this video, we go over allergic rhinitis. As we're going to learn, though, there's actually 3 different types of rhinitis: allergic rhinitis, non-allergic rhinitis, and a mixture of the two. That's why it's important to get tested to know which one you have so you could be properly diagnosed and treated. But no matter what, you want to be feeling wonderful. That's the great thing. All of allergic conditions, you can be living a wonderful, fantastic life. And rhinitis might be the most important because it affects hundreds of millions of people around the world. In this country, who knows how many really allergic rhinitis people there are? Maybe 40 million, but rhinitis overall might be up to 100 million. How many people do you know, if not yourself, that actually have all these different nasal symptoms and it drives them nuts or you nuts, and nobody does anything about it? And this is the problem with allergic disease. People have stuff and they don't really realize they have something or don't do anything about it because that's the way it is. I'm supposed to feel this way, or I don't know any better. A lot of these people have a genetic component, and then for mom, grandmother, uncle, everybody has it in the family, so I'm supposed to live like this too. And the answer is no. You could be living a wonderful, fantastic life. So again, a very prevalent disease, meaning it's out there. You have it, or your family has it, friends have it, and so it's something that when listening to this video, you're going to go, gee, you know, this might be something I should look into, or I should have my kids looked into, or my family members, because, again, it's something that is treatable and you could be doing fantastic. So how do you know that you have rhinitis? Well, first of all, you just get a stuffy nose. Some people have a stuffy nose, you know, it's like this, and some people actually mouth breathe most of the time. I mean, they have nothing here. They're just total mouth breathers. Disturbing, but also creates sore throat and other things we'll go through. But again, it's not a great condition because you're just like feeling like you're underwater all the time. Or you feel like this. Okay, you get that Darth Vader syndrome. I mean, you could tell people who mouth breathe. They have a certain way of talking and breathing. The other thing you get then, besides having the congestion here, is mucus production. And that leads to a lot of blowing. Some people are keeping Kleenex in business because they're just constantly going through tissue after tissue. So again, you don't want to have that constant discharge of mucus from your nose. You get a lot of sneezing. You know, some people sneeze occasionally, that's fine. But if you get a lot during the day, or you get these repetitive sneezes, they can be disturbing, bothersome to other people. Or if you really sneeze well, try driving when you're having a sneezing attack. All right, it's hard. You could have itching of your nose, where you just have rubbing. We see this with little kids every day. In fact, there's a term called the allergic salute, where they're going like this all the time. And they actually get a little crease here. And that's because they're constantly itching and playing with their nose. So it's kind of easy to tell on kids too. Actually, another secret of little kids is that they get these little shiners. It looks like they lost a fight in the schoolyard. You know, they have this purplish thing here. And that's because the blood from the face drains through the nose, through these vessels here. So if you're congested here, the blood pools. And as you know, blood is bluish purple, and it probes here. So that's when you can just look at a kid and go, this is an allergic kid. Just the opposite. You know, once you treat them well, those go away. So again, allergic shiners are a good identification, like that kid's allergic. With the mucus, you have stuff going down the back of your throat. That's post-nasal drip. Some people just feel it on their own. Many people have a cough. And a lot have throat clearing. They go, like that. They hear it, their family hears it, their coworkers hear it, drives people nuts. So that's something that, again, that can be eliminated once you get the rhinitis under control. If you swallow enough mucus, you know, well, if some, you get a sore throat. But then if you swallow enough, you get all this stuff pulling your stomach. You get nausea. You know, people say, oh, if you're queasy and all that, because I hope you're not eating right now. But you get all this thick, juicy stuff sitting down there and doesn't make you feel good, can affect your appetite. But if you're really swallowing a copious amount, you can actually have vomiting. And when you vomit, you know, you'll look and it's got mostly mucus or all mucus, because that's what's been accumulating down there. We actually had one case where a gentleman came in with one of these metal trash buckets. And he vomited twice in the waiting room, vomited on the hallway back to the room, vomited twice in the room. And you look and you play with it, and it's like all clear, it's all mucus. So I said, his wife was best. We're not going to treat today. We're just going to set up my basic rhinitis care, which we'll go through. Saw him 3 weeks later. The wife goes, he hasn't vomited once since he left your office. That's how bad it can be. So that's funny. Sometimes we get chronic vomiting cases. Sometimes I used to think, I'm not a gastroenterologist, but it is all due to allergies, all due to rhinitis. Up here, you can be affected. So your air-filled sinus cavities are up here. And the reason you have sinus cavities, people speculate, but part of it is just to lessen the weight of the skull. Because if we had all bone here, we'd all have necks like linebackers. Right? So they're air-filled, but for some reason they're also filled with sinus tissue here too. So normally they drain through small tubes through your nose. They're called ostia. And there's a nice equilibration there. But if you're swollen in the nose, then it blocks these tubes, then air fills up, and you get pain or pressure in your face, either here, here, or throughout here. You can also lead there to headaches. And that's because, again, this gets closed off, and it's a closed system, and the air expands, and it really, really hurts. So again, keeping up on the rhinitis can prevent facial pressure and pain and headaches. The other thing is that since this is mucus producing, well, if that gets trapped up there, you get sinusitis. And the appropriate treatment, if it's bacterial, is that you would use an antibiotic. So some people will do that and they'll get better. But some people treat, and then a month later, they have another case of sinusitis. They treat it. Then a month or two later, they have another episode of sinusitis. And the reason is the same mucus that's up here doesn't get out, and it gets reinfected over and over and over again. And then that's called chronic sinusitis. And they keep taking multiple antibiotics. Some they go in for surgery. And that doesn't work for that all the time because, again, it's just a drainage problem per se, but it's inflammation. It's not a physical defect that has to be gone after. So all these different things come from having a bad nose. And that's here and here. There's another side to this. If you take a proper breath, not that many of you out there could, air goes down the breathing tubes. It starts at the nose and goes into the airways, into the lungs. Okay? This is one big tube, one system, same tissue, they talk to each other. So if you're having chronic congestion and stuff going on here in mucus, it can translate down here at times. Or if this is constantly congested and inflamed, then eventually the lower airways get inflamed, and that's called asthma. That's an important point because 25 to 33% with allergic rhinitis go on to develop asthma. The cool thing is, though, that might be preventable. The studies in adults they're still doing, but in kids it's been shown that up to 50% of children who have allergic rhinitis, properly and aggressively treated and genetically predisposed to asthma, never get it. So like me, I'm great at treating asthma. Love asthma. You may see that in another video. But the cool thing is, what if you could prevent it? What if it never got there? And that's one of the things you could do about treating rhinitis, especially in children. But I think it also works in adults, the same pathology. So again, those are the symptoms of having allergic rhinitis. I did mention, though, that there are 3 types. So how do you know there's rhinitis? Well, for me, the first thing is just to look in the nose. You'll get one of those, otoscopes will speculum, you look in there. And I define it by the degree of inflammation, mild, moderate, severe, and the degree of obstruction, 20, 40, 50, 60, or 98.2. In this way, I have an idea how bad it is, and then when we're treating, we can always go back and look at our notes and tell the patient, oh, it's now 60 or 50 or 20. It's a good gauge for me, but actually my patients love to hear what the degree of improvement was. And the tissue is just red and angry. So that's what you see with allergic rhinitis. But again, I like the history. You hear all this stuff and you say, this poor person's miserable and suffering. We should do something about this. So then it's a question of, why is it happening? That's why for all our patients who come in for rhinitis, we do allergy testing. As you can see in another video, we go through how do you do allergy testing. But just briefly, we just do prick testing in the back, maybe intradermals. We don't do blood tests because blood tests are very expensive, they're painful, and they're sometimes too sensitive. So you should never really start with blood testing for allergies, you should see your friendly neighborhood allergist and have this done. I'll make a side note, you do want to see your friendly neighborhood allergist. There are other entities out there, primary care physicians and ENTs who do testing. They don't do a 2-year fellowship in allergy. They don't know the nuances of skin testing. They don't know the nuances of treatment. So I'm not trying to berate them, but if you had cancer, would you not go to an oncologist? If you had a arrhythmia or heart problem, would you not go to a cardiologist? So if you got allergies, nose problem, you should be seeing an allergist, board certified allergist. It's a little plug for us, but we're a specialty for a reason. So we do the testing, and if it's positive, okay, we know it's allergic rhinitis. So as we went through in the other video, then antihistamines would be appropriate, good environmental control, and then nasal care, which we'll go through. If it is non-allergic rhinitis, what does that mean? Some people are disappointed, oh, I don't have allergies. It's like, no. You have dirt, dust, particulate matter, irritants that get into the nose, and that's what causes the inflammation, the swelling, and the mucus production. So the good thing, it's treatable and you could be wonderful. The good news is you don't have to take antihistamines every day. The bad news is that you can't get rid of it. So with allergies, immunotherapy allergy shots work up to 75% of the time, 80% in kids, and it's curable. Where this is a condition you always have. But again, with good environmental control and good nose care, you'll be in good shape. How do you treat rhinitis overall? So there's another condition called, or a mixture. There's another condition which is a combination of both allergic and non-allergic rhinitis, where dust, irritants, and particulate matter bother you, and also have some allergens. The most common finding we see on our testing is that they have a lot of outdoor allergens, whether it be trees, grasses, weeds, molds. They have no indoor stuff. And so they're still suffering during the cold months when everything's dead. And the answer to that is they have the non-allergic part from dust or particulate matter at that time and throughout the year. And then they also have the allergic part, which can range from here, February through November, when the first frost comes in. So again, allergic rhinitis, non-allergic rhinitis, mixture of the two. So how are we going to treat allergic rhinitis? What should you do? Again, I think the best thing is environmental control. If it's indoors, as we went through in the allergy video, doing HEPA air cleaners, HEPA vacuums, taking care of the heat and air system, shoot the dog, bury the cat. Nobody really goes with that. Well, you can always wash the dog, wash the cat. We go through how to do that. If it's molds, taking care of that with a good mitigation service to come in and take care of that, and certain other things. Hypoallergenic coverings for the pillows and mattresses for dust mites, cockroach elimination, which again is really a professional job. You're not really going to be able to do it on your own. Vermin problems, hire a professional, take the money, get rid of them. But again, if it's not there, it can't bother you. And remember, you want to do it at home primarily, but maybe you can do it at work. You can't do it at school unless you're a teacher and you have your own office. But depending on work, if you're in a big environment, we'll go through that. But if it's a small environment, maybe you could do environmental control there. But again, can't see it, won't bother you. The primary treatment for allergic rhinitis, the number one thing that'll make you feel wonderful, nasal washes. Yeah, I mean, it sounds bad, but it's not that bad. And done gently like we teach it, it should be just fine. But the purpose is to wash off the nose allergens, antigens, dirt, dust, particulate matter, get all that stuff off the nose so nothing is there to set off the inflammation and the swelling and the mucus production. So again, a good wash done twice a day is wonderful. I mean, when you finish, hear that? That sounds great, right? My allergies are cured and I still do nasal washes twice a day because you want to have that wonderful free flow feeling and not have mucus in there. That's the real secret. And when you finish again, you're going to feel like everybody else is supposed to be feeling. There are different ways to do them. There are all these different devices out there. There's the neti pot. There's a thing from Waterpik, Waterdyne. There's different ways to do them. I'll give you my favorites that I use personally and I use for my patients. There's a bottle system out there by Neomed, and it's a plug for them in a way because it's a good device. And they come in 4 and 8 ounce bottles, for pediatric and adult use. and you just fill it up with water, put their packet in, and use it. There's a debate about what to do for the water. You know, the boxes will say, oh, use distilled water. You know, if you're a purist, fine. But you got to remember the bottles are made in India and they're distributed to there in Mexico and Indonesia and other places where maybe you don't want to be drinking the water. So my rule is if you'll drink the water, use the tap water, warm tap water. If you're scared, hey, err on the side of caution and use bottled water. There was only been one case in the United States where somebody got into trouble, and that was in Arcadia down in Louisiana. Somebody used water from a contaminated well. It had amoebas in it, actually, and they got in there and then got into the brain. So that's an extreme case, but technically you shouldn't have been drinking that water. So again, just warm tap water. Should you heat up water in a microwave? And I kind of don't like that because I don't want you to burn your nose. So just good warm tap water. Now the salt solutions, they come with packets of 100. You can use those. If they irritate you a little bit or you want to stretch it, sometimes half a packet works. If you're a little irritated still, a quarter packet. Or some people use just plain water, like me. I just use tap water and I don't put anything in it. Some people, that drives them nuts. It creates this irritant feeling like, how do I do that? So you find what's best. You know, pick whatever you like. But there's even a way to make it up. The formula, you're writing this down, for the 8-ounce bottle is half a teaspoon of sea salt or kosher salt, 1/4 teaspoon of baking soda, and just mix it up in warm water. Do it fresh each time though. Try not to make a big solution of it. Just, you know, make each one up fresh morning and night. And that's the thing, twice a day, at a minimum. Now, if you're exposed during the day, you want to do an extra wash. What does that mean? Well, if you are in a dusty garage, moldy basement, or some situation out in the fields or something, you may want to come in right after that and wash that nose out. For my people who are in garages or out in the fields, what I recommend is they carry a bottle of saline spray, or, you know, the main one is ocean spray, but everybody makes it generic. 2 sprays into this side, massage, 2 sprays into this side, massage, and then blow. Gets everything out. Do that 3 or 4 times. That's like doing a modified wash on the spot. This is also a good technique for recalcitrant kids. Some kids, when they get to be 2, 2.5 till about 4.5, 5, will not do a nasal wash with the bottle. And so what you do is you just use the saline spray and do this and that, and they'll blow and get it out. So again, modified saline washes. The other one I use, especially in teenagers, is a modified wash. What does that mean? Well, you can do this in the shower by the sink. Again, like me, if you can take water. So what I do is I stand in the shower and I just cup my hand. Do that 5 or 6 times. Next side. Clean. Takes 30 seconds. Just make sure it all goes down the drain for the next person. Then you can use a sink. Like at night, what I do is a sink wash. So you can just stand over the sink like that and do a wash at night. Take 30 seconds, get everything out. And so those are good for those who don't have the time or you know, just don't want to do the bottle or take the time to do it. So again, and modified washes could be done anywhere. They could be done, you can do it in a public restroom. You know, if you're at work or somewhere, you can do it in, you know, private restroom. I've done this on planes at 38,000 feet. I won't mention my favorite carrier, but I do it up there all the time, you know, in their sinks. It's just different planes with different configurations have different sink types and water times and stuff, but you get used to that. So getting back to the regular nasal wash, again, neti pots kind of go in and out, don't really wash well, and it doesn't feel good throwing through here. And the water pick has changed the device, so instead of really blasting the tissue, it's a kinder, gentler action that they use. And there are saline aerosol sprays that you can use, but just a tried true bottle works great. Secrets of doing a comfortable, wonderful wash. Do it gently, like this. The box says, make it go through the other side. I don't believe in that. Because first of all, that just feels, if I had to do that, that'd be, I don't know if I'd do my washes. That feels funny, right? The second thing that produces is that then the water gets trapped here in the turbinates and it drips out 20, 30 minutes later. Socially unacceptable. Also, if you do it hard, it can get back in the ears. I have a complaint a lot from my patients. Oh, my ears, you feel plugged or there's water in there and stuff. They do it gently, boom. They don't have that problem anymore. So gentle. The next thing is to do it like a clock. And then what I mean by that is you just put the nasal wash bottle up here and then gently, not hard, gently go 12, 3, 6, 9, 12, 3, 6, 9. And just keep doing that until half the bottle's gone. Put it down, take a tissue, blow. Then do the other side, 12 if you're ambidextrous. 12, 3, 6, 9. And do the other side for 4 ounces. And then blow. And it feels wonderful. Honestly, I have done washes and said, oh, I wish I could do another one, because the stuff that came out, and you just feel so good. It's like, wow, I'd like to repeat that experience. You're going, you got to be kidding. I go, but once you do your wash, you'll love this stuff. Okay. Now you can take your bottles with you. Remember, take it on vacation with you. Watch what country you go to. Again, you know, you drink the water, use it. If you don't drink the water, don't get bottled water. Bring your salt packets with you. This is one place where salt packets might work, because if you're carrying baggies of salt and baking soda, you know, TSA is probably going to have a problem with you, and you may not make your flight. So you know, that, or put it in your, you kind of want it in your hand luggage, because you know, if your luggage gets lost, you want to have your kit. Or maybe you want to put your bottle in there and put your salt and baking soda in your baggies in your main belly luggage in the plane. But again, you want to take these with you. So again, doing a nasal wash, doing it correctly, doing it comfortably, doing it twice a day by whatever means, the bottle, the modified washes, the saline spray washes. But again, that is the secret of my rhinitis care. I'll actually give credit to the institution I trained at. They're the ones that actually taught me this. We actually used a bulb like from the nursery before these bottles came out. And that was okay, but you know, they're hard to get and they eventually wear out and hard to clean. So the next thing is, well, why is all this happening? Why am I having congestion and mucus and swelling of my turbinates? Because there's inflammation, whether it is allergic or non-allergic. So what you want to use is an anti-inflammatory compound for the nose. There's one out there, and I know a lot of you have steroid phobia. It's called nasal crom. It's actually available over the counter. So nasal crom, because the chemical is cromolyn. For you Conan fans out there, you know, the barbarian, you'll know Crom from the god Crom, so you can remember it that way. But nasal crom is good stuff. Technically, it's a 4-time-a-day medication, but 4 times a day does not work. It is not happening. Even 3 times it isn't happening. So I have my patients do it twice a day. So is it as effective as the other things I'm going to mention? And the answer is, for some people, yes. And others, it's not as effective per se, but I know a lot of you want that option of not putting steroids in your nose. I will say, though, that there is not systemic absorption from the nose, or minimal. It doesn't happen that often. The studies they've done in children have shown that there really is not a problem. There was one study that might have showed it, but it was a very bad study. They didn't do the age groups right. Another study in the same journal, same issue, showed that using another nasal preparation caused no problems whatsoever. It's funny because there was the same author for the 2 studies. I actually had the privilege of speaking with him the other night at an Allergy Society meeting. We were going over those studies. So we don't worry about systemic absorption per se, although there is the chance, theoretically, that because there is a connection between the nose and the eyes, sometimes using them with glaucoma or cataracts could cause a problem. I think that's something to discuss with your ophthalmologist. My patients, if they're scared about that, they have the nasal crom. Then the other mainstay of nasal therapy are nasal steroids. And there's a lot of different ones out there. They vary in potency, they vary in delivery, and so you're a physician and you can sit down and figure out which one might be best for you. Or if you try to do this all on your own at home, then what you want to do is do the washes and pick a spray. You actually have 2 over-the-counter sprays right now, Flonase and Nasacort. They were prescription meds. They both work well. Personally, I gravitate towards Nasacort because it's a good compound on its own. Flonase or fluticasone works well, but some of the manufacturers put a scent in the spray, and they say it's part of the preservative. I'm sitting there going, why would you put a scent in a nasal spray? This does not make sense. So if you're using over-the-counter, that may be the one you want to gravitate to. There are both 2 puffs to each side, once a day over the age of 12. Under the age of 12, just 1 puff. The ones that we use for prescription, I think our workhorse might be Nasonex as a liquid or aqueous spray. and that goes in the nose, 2 puffs to each side every morning, 1 puff under 12. And this helps take care of the inflammation. There's another mist spray called Veramist, and that's a fluticasone product. And you do it sideways, and that goes in as a mist, and that's more soothing for a lot of people. And maybe it doesn't always drip down. If you have a problem with drip in a nose spray, remember the real thing to do is 2 puffs, 2 puffs, like that, so it stays in the nose. There are now some aerosol preparations there, and we say aerosol, it's like an asthma inhaler. And what they do is they come out in an aerosolized form. I'll show you one. Just like that, you put it in your nose, comes out like that. I like these for some people who don't have a problem with the drip, but also when they have a very, very congested nose or it's almost occluded. You know, if you do a liquid, it's going to kind of get stuck in the front. If you have the aerosol, it kind of blasts and hits the front, back, and the side. So there are 2 of these available, Q-Nasal and Zetona. They both work very well. It's just a matter of insurance coverage, you know, if you can obtain these at a reasonable price. But those are the main sprays as a nasal steroid. And again, don't let that word scare you. All right. There are other sprays out there that are nasal antihistamines. So these are for our allergic people because they have histamine and IgE. If you're not allergic, this is not going to do anything. There's no histamine to go after. So that's another reason to get tested, not only to know if you're allergic, to know what you're allergic to do good environmental control, to respond what you're allergic to. But then this series of medications like Azalastin, which is the generic name, Patenase, these 2 sprays go in there and mop up allergic inflammation. So again, a good preparation. You can be used in conjunction with the nasal steroid of your choice. They're twice a day though, remember that, 2 puffs twice a day. There's a combination spray out there called Dimista, which is actually a combination of the 2 in 1. So like the asthma inhalers are now combinations. This preparation has both Azalastin as an antihistamine and fluticasone as a nasal steroid. And putting them together makes it more efficient. It's just easier than using 2 different sprays and cost effective in that you have 1 copay instead of 2 copays. That also, though, is a twice-a-day medication. For all the things I just mentioned that work well, they're not going to work unless you do the nasal wash. The reason is, first, the nasal wash, again, takes off the nose allergens, antigens, irritants, dust, and stuff. It takes inflammatory chemicals off the nose, and it takes the mucus off the nose. So when you finish, that's why you feel wonderful. But this gives the spray a chance to work, because when you look in the nose, like I said, I see inflammation or redness, I see swelling, but I also see a glistening in the nose, and that's the mucus covering the nasal tissue. So if you put a spray in, is any of it really going to touch tissue? Or very little. But if you wash it away and then put the spray, 100% of it gets there and does its magic. So it can actually work. Otherwise you're treating snot and mucus and you're wasting your money. That's why people go, I don't want to spray, they don't work. Why? Because it never reached its target. So that's the other advantage of a wash. So again, for allergic rhinitis, environmental control, nasal wash, nasal spray, antihistamine. Non-allergic rhinitis, environmental control, nasal wash, nasal spray. These regimens make you feel wonderful. And again, there's so many people out there. You could be doing this, again, at home, at work, on vacation, but very important to be compliant. So this is Dr. Bill Lanting, America's Allergist. Thank you for listening. I had so much more to say. How did I run out of material? Ugh.
It's 30 minutes.
Yeah.